Hi, my name is Sam, and usually I do cath and EP education content, which is healthcare, but today we're kind of going to address everybody. So in this interview with Constance, a licensed mental health counselor, we're going to talk about anxiety, overwhelm, being a newbie, training somebody who is dealing with anxiety. This video is not just for healthcare professionals, but it's for anybody dealing with anxiety or knows someone with anxiety. There's a ton of value and strategy and tools to put in your toolkit packed into this two-part interview, so tune in and share with somebody who might need it.
Hi, and welcome to Don't Miss B and Don't Miss his YouTube channel. This is Constance. Fun fact, she is my therapist. Okay. But I brought her on because I get a lot of messages of, and I don't know if it's just the culture of things going on in healthcare now, but a lot of people mentally struggling with either patient deaths or complications or self-doubt, and a lot of that spiraling. And obviously we can't show that professionally at work, right? So it's a lot of the things that I end up talking to Constance about anyway in our session. So thank you so much for lending your time and for being willing to answer some of these
questions. I love being here. Absolutely.
But I'll let you introduce yourself, who you are, what you do.
My name is Constance Nelson. I'm the lead therapist and the CEO of Constantly Healthy Counseling and Coaching. It's a small boutique practice in Winter Park, but I do coaching for businesses, CEOs. We do everything in our practice to give it well-rounded, but I love working with professionals. I mean, I love all my clients, but I love working with professionals because really taking that into the business or taking that into their company is really important, especially nowadays when the volume seems to be up on the tension around us. So I think regulation is super important.
Yeah, everything does feel so much more amplified, I think. And
amplified is a great word.
Yes. And, overwhelming. Depends how you frame it.
And then we overfunction. So all the overwords definitely are part of it.
Yes, and that's what I really came to, because I was just tapped out on what I felt like I could navigate myself, and that's kind of our closer question on when do you start to recognize you need that level of help, and there's nothing wrong with it. We just we're humans and we have other things going on in our lives and we can't handle everything ourselves. What do you tell me? Do whatever, delegate the rest.
Do what you do best and outsource the rest.
Yes, that includes therapy. I think.
Very good. That's right. That's right. Let me take my brain for sure.
Yes. So kind of the first thing here of just initial tools, because I think that's a lot of quick takeaways that people can have. How can I really debrief at work in a professional setting and take that pause? What should it look like, and how do I kind of check in on what I need when I am feeling that overstimulated, overwhelmed?
Well, I think we shouldn't wait till we feel this way. I think it needs to be proactive and not reactive. There should be a daily practice that you have for yourself that you're doing every single day. It's kind of like going to the gym, or running a marathon. You're not going to work out the hour before, right? So you want to condition those muscles all the time. So something daily would be important. I have a face mask that I use that's nice and cool, which is also good for the pores, but it lowers the dorsal vaga, which is that stimulation in our brainstem that kind of takes the volume up on our anxiety. So you can do that a couple minutes in the morning, a couple minutes in the evening, and then driving home, doing mindfulness, blue car, green car, always trying to be in the moment. That's how you bring your mind back to your body and get that regulation.
Okay, so what would that look like for me? Well, for context of what we do, right? So you're entering the hospital, clock in, you have 6 or 7 cases for the day, you scrub in, you're with the team, and then maybe there is a little break, so maybe there's about 10 minutes between patients of cleaning things up, but nobody's really kind of talking to each other. Sometimes we're playing music, but is there something I can do kind of like that, but in a professional setting where I don't have to speak anything, and I'm just kind of mentally doing it while I'm turning over the room?
Yeah, no, that's good too. So if you're already doing this in the mornings and the evenings, you're conditioning your parasympathetic, which is what you want to do. Okay. I call it Tinkerbell. The more that we get Tinkerbell nice and exercised and relaxed, the easier it is for us to flow into a relaxed state. The less she is stimulated, the more that the frontal cortex, that's the Hulk, we're always in that fight, flight, freeze, the more we're going to be stuck there. So we want to make sure that we're practicing building Tinkerbell, building those skills to help ourselves regulate. And then in the room, you can always tap back and forth on your arms or tap back and forth on your legs, because this crosses the cortex from one side to the other. So it also gives you some nice common feeling.
Oh, so even when I'm like, I'm scrubbed in and sterile, I can just kind of like
Yeah.
tap on the table.
Absolutely, absolutely. And then in those rooms, you can be looking at the room, blue wall, what's over here. You start to recognize everything around you. That takes you from that fight, flight, freeze into that parasympathetic, that relaxed state as well.
Oh.
Coming into the moment is what you're trying to do. Mm-hmm.
Yeah. I like, and nobody knows you're doing it. Mm-mm. But if someone asks you, you can be like, well, actually, this
I'm being
really
mindful.
helps me.
Yeah. Mm-hmm.
It's hard when you're scrubbed in and like everybody's looking at you, so you're like, I don't want to start singing to myself or doing something that's going to call attention to myself. The patient's awake and they'll be like, what are you doing?
Exactly.
Like, oh, I'm trying to center myself because I'm really stressed out right now.
Yeah, we definitely don't want to say that.
Not out loud, in my head.
In your head, exactly.
So this is quote by quote what someone messaged me. I constantly feel not good enough. When we have people with more tenure, so they're more experienced, and I want to be at their level. When we have crazy cases, so high-risk cases, management picks more experienced people for safety, but somehow it's hard not to have your feelings hurt by not being skilled enough. And I get it. If my grandma was on the table, I would want the more experienced person, but it feels like a never-ending cycle, trying to give myself grace, but being super hard on myself too. How do I even begin to navigate this?
I think generationally it's tricky because the boomers, they came in, they're the generation that's left. They walked up the hill in snow both ways. They're used to this, they're used to struggle, they're used to problem solving, they're used to like, mom didn't make the dinner, they figured it out. The Gen X came next. That's my generation where we also walked up the hill both ways. So we have a little bit more resiliency and it's no one's fault. The millennials and the Gen Zs don't seem to have as much resiliency. That's not their fault. It's a little bit their environment. Of course, Amazon, the culture, everything around us is so push button, so the resiliency and that wisdom isn't there. And I think sometimes my younger generation thinks they should already have the wisdom.
Yeah.
And that's going to lay a layer into, I have a new client or a new patient on the table. I'm not prepared.
Yeah.
When a boomer, I think back then wouldn't maybe care as much, but because the resiliency in the younger generations are not there, I don't think they have much to land on. Does that make sense?
Yeah.
We have to build that.
We're the people in charge are probably usually the boomers who have these expectations because they rose to those expectations quicker in their mind.
Yeah.
And it was, I always say, but you forget what it was like to not know anything.
You're right.
I'm sure you did feel maybe a little insecure when you did start, but you didn't, it doesn't seem so fresh because it was longer ago. And now you're that expert person and we don't really pay attention to how we got there or how long it took us to get there when we're in that, I am the key person now. You don't really reflect back on that too much.
It's true. Yeah.
I would say more in the, I do have two categories. I have the first-time college students just graduated and get this big-time job, right? With very, very serious high-risk job. But then I also have the second career people that have a lot of self-doubt, and that comes with a whole different bag of things because they used to be that go-to person. And then now they're coming into an environment where they don't know anything and they have to kind of put their ego aside for a second of actually, I don't know any of this. But there's that, maybe because they hadn't been faced with that type of need of resilience earlier. That's like, oh yeah, let me try to remember, how do I tap into that again? Because I haven't been that uncomfortable in a long time.
Yeah.
And then the people that are training them are the Gen Zers, Gen Xers that are much younger than them, but they're more skilled because this is what they do every day. They're good at it. And I feel like both sides are hard. The newer, I say bright-eyed, bushy-tailed ones who are ready and eager to learn but have a lot of self-doubt. And then the second career people who came in and are now realizing, oh, I don't know what I'm doing and this is very uncomfortable and I don't remember how to work through this.
Yeah.
Because I can't remember that time of learning something new again for the first time. And I kind of get both. And I don't know what the right advice is for either of them because they're similar scenarios, but they come with different baggage, I guess, so to speak.
Well, if they're really dealing with deeper, this lower self-esteem, that's something a therapist or a coach really needs to get in there and help them with. We don't want to continue to like beat ourselves up. And the pop psychology term of imposter syndrome, which is not a
yes.
thing. It's something we made up somewhere. That's not a thing. It's just you need to learn wisdom. But I think sometimes the younger generation, they think they should already know the wisdom, and they don't. They have to earn it. Wisdom is earned. Wisdom, you don't get wisdom. And sometimes my parents try to teach their kids wisdom. I'm like, you can't do that.
Just telling them this is
Yeah,
what you
that
need.
doesn't work. I mean, when I was a kid, I just looked at my mom and smiled and did whatever I wanted. Today, the kids push back, which I guess is fine. But, dealing with this on a daily basis, I think would really help them. Getting a good therapist, getting a coach, really working through those pieces of low self-esteem, because that's going to really show up at that table.
Yeah, I would say, does
Right?
it not usually come from the immediate moment? It's
Right.
probably all of these other things.
Probably. There's things back here. So in that moment, if they show up at the table and they feel, let's say 0 to 10, they should be angsty about a 4. But if they're 0 to 10 to an 8, then there's something deeper going on. And that's when they should really look at getting a therapist or a coach, someone to really dig into those deeper pieces in them so we can lower that anxiety, organize whatever thought process or belief system is not giving them that opportunity to sit up or stand up at that table at a 4.
Yeah.
Does that make sense?
It does, because I always say I get concerned if people are too chill when they aren't that exemplary yet. They don't know everything. I'm like, okay, I feel like you should have a healthy level of I'm a little nervous.
Should be a little angsty. There should be a little bit of angstiness. Yes,
But not,
agreed.
the blinds coming in completely shutting down and blanking,
Right.
which tends to happen a lot, unfortunately, from what I've seen.
That's fair.
And I'm like, what's happening? You just forgot everything that we talked about. And they're like, oh, I just got so nervous. I'm like, but you got to take one step at a time, or you have to take some time for yourself and work through whatever it is that's literally blocking the freeze, I guess, that's completely blocking you out of being able to perform.
Yep.
I call it performing.
And if they're dangling from a cliff, which the brain will do, so they're over a 5, 0 to 10, they're over a 5, they're dangling from a cliff. The brain believes that. So their vision gets narrowed. So they're no good to anyone when they're in that state. So knowing what state they're in and knowing how to get to a lower number, and that's something they can practice all the time. And if they can't get to that lower number, then getting a therapist or a coach, someone that can really dig in there and figure out like what's going on, so they can it'll be easier for them to approach their clients or their patients.
Do you have any advice if I'm the preceptor and that's my preceptee, right? That's my student, let's say, and I see that happening? What do I do? Because, patient on the table, yes, and I will intervene, but some people do not recognize that's what's going on, and they just think they're not capable, it's them, they're shutting down, and completely push them aside, or yell at them. I've seen that too, of what are you doing? You can't, you need to do this, da, da, da. So how should you handle that when someone's going through that freeze state and I'm responsible for you?
So let's say, so what I hear you saying is there's a patient on, so this is real time.
Yes.
There's a patient on the table.
And I'm giving you an opportunity to try and
And
do
you're
this
there,
procedure.
and who else is in the room?
The physician,
The physician?
me as your preceptor, me in charge of you, and then one other person who's usually a circulator, not scrubbed in, so they really can't help. They can verbally help, but they can't physically help.
Is there a way for them to get in that room ahead of time? Is there a way for them to feel into the room, to breathe into the room, to know the room? Anytime you can do some pre-work here, they can go in the room, feel out the room, kind of see, get into the moment, maybe even stand up to the table, close their eyes, actually visualize a client on the table. They start to get anxious, they can tap, tap, tap. I think doing some pre-work would be important, that when the brain gets in there and it's in front of the patient, we've already kind of regulated a little bit.
Yeah, that makes sense. Because we don't,
It's like exposure therapy a little bit.
Yeah, it is, because it's almost like this, right? If I was nervous to record a video, I can do it at home, but then when you have the lights, when you have a microphone, and when you have all the setup and all the people staring at you, then you kind of start to shut down.
Right.
Versus if I expose myself to that stress without it being the on moment,
Yes.
might be helpful.
Yes. Yep.
I'd be
Give
like,
them a
I'm
little
gonna
edge.
lay on the table. I'm the patient.
Exactly. Exactly.
Yeah.
Well, how are you
Come in,
feeling?
talk to me.
Yep. What number
Yeah.
are you? I'm at really high. Okay, then, let's tap a little bit. Let's take some breaths. Come into your body. So this is the kind of thing they're going to need when a client is laying on the table or a
Yeah.
patient's laying on the table. Grounding is important, like coming into their body. So if you're on the table and you're practicing with them, you can say, what's going on in your body? I feel tense here. Okay, let's tap through it. Let's get to a nice 40. 1 and 2 and 3 and 4. Usually a 40 will get them, the brainstem, I think that's about the scientific piece to get to that 40 number, and it kind of starts to integrate. And I'm still feeling anxious. Okay, let's do another 40. Take a breath, do another 40, and 9 times out of 10, the feeling will start to move.
Yeah.
If not, then we know we have a deeper problem.
Right. And if you keep ignoring it, it's not going to.
Oh, it'll build and blow.
Yeah, you're telling yourself you can keep shutting down and not force yourself to work through it in the moment. From a preceptor perspective, so legs is not an unless you're circular. Legs is not an option because you're going to contaminate. So you're sterile from the chest up, so you can do it on the table, on the sterile table. I actually used to do that in a different way. We have a sterile saline ball on the table, and I would get very hot and anxious, and it was cool. So I used to like put my hands in there and kind of fidget around and like, I know it's not physically cooling my body off, but I'd be like, the saline is coming into my arm. And I was like, I'm cooling my body down. So if you're sterile, you can do it on your arms without contaminating, and then you can do it on the table. So both of those work really well. And I think as a preceptor, having that conversation, if that's the first time you've seen it in your preceptee, have the conversation off the table of that. What are you feeling? What is going on? Where are you feeling it? Have you tried some of these tools before? So the next time it happens and we're scrubbed in, we have like a cue of I'm shutting down. And instead of me completely kicking you out, I'm just essentially going to give you a timeout to work through it. I'll take over and then tap back in when you're ready, you know, for me to allow you to take over again without demeaning you in front of a physician, without bringing it up in front of a patient. We just have this cue of we've had this conversation before. I know that you get overwhelmed in this scenario, but I know you have the tools to try and work through it. I just need to give you that opportunity.
I love that. Managing expectations are really important so they know what's coming. That's going to be a lot easier on their nervous system.
Are they going to yell at me? Yeah.
So I think doing it ahead of time, managing expectations are really important. Yeah. And that way they can be doing it in their mind, like go home and practice this in your mind, tap in your mind, go through the whole piece in your mind. And then the brain again gets used to it.
Yeah, that's a great idea.
It's not a fail-safe. I mean, they still may be anxious, but at least it gives them a little bit of tools and they have a little bit to know what's coming next.
Yeah, and I get it. In the moment, you don't know what to do, and sometimes other people amplify it because they also don't experience it themselves, so they don't really recognize it or know what's going on with you or know it's not something you can just switch on and off, that you kind of have to scale down from almost. And while you're in orientation, that's a great opportunity to recognize like what situations trigger that for you. And it's not that you can't do this job, but you can't ignore these things that you're going to be on your own. So you have to put yourselves in those scenarios and try to work through it and see progress. So then when you are on your own, you can manage it maybe in 3 seconds instead of 15 seconds. And it kind of slowly gets down through that. Because we all have those moments where I'm just like, I need a minute to figure this out.
Well, exposure therapy does that. Like every time it gets better and better and better and better. That's what the brain does. The more it's practicing, the more it's exposed, the less of a reaction you have. So that's what the brain is supposed to do.
Yeah.
Right?
Goals. Physicians get that way too. They're not as good at it, but I used to have a physician who would stop and he would pace. And he would walk back and forth in the room and just didn't say anything about it, and then would come back and we would continue. And I'm like, are you good? And he's like, yeah. I went, okay. And that was his thing. You could tell when it was like a heated moment, he just took a time out and did that really quick and came back, and none of us acknowledged it because we didn't really know what was going on until I felt it before. And I was like, oh, I think that's just his way of centering.
He's regulating.
Yeah,
centering, regulating, grounding, all those terms.
Yeah. And I'm like, don't make fun of him for it. Good self-awareness.
Yeah, very good. Nice self-care.
Versus exploding on everybody. That's not helpful. Right?
Exactly.
The next one is we're going to progress a little bit to now when I've made a mistake, but it didn't cause patient harm. Because that happens a lot. So let's say this is a really sad equivalent, but you're about to drop a bowl, but you catch it, and you're like, oh, great catch, but that could have ended in a disaster, right? Or almost car accidents. And you're like, whoa, that got really real for me for a second, but we didn't collide. So you have that initial mistake. You kind of go through the shock process of suddenly it's reality of, oh, wow, like I'm capable of messing up. How do you avoid spiraling? Where one, I want to check what I'm doing. I want to slow down a little bit and be more mindful, but I don't want it to completely knock out my confidence where I then overthink on every single thing that I'm doing. Does that make sense?
You mean in the moment or after the moment?
Both.
So after the moment, you could tap your way through it and relive it every time. And back up from the moment, see everything around you. Again, the brain is just looking for organization. Once we organize the thought, the brain is good. And repetition pretty much organizes the brain. Not always. Again, there's deeper things going on. If you can't get to that place, there's nothing wrong with you. It's just your brain. You're not your brain chemistry. You're not your brain stem. The brain has got something stuck in there. So I think after it would be to breathe through it, tap your way through it, make sure that you're cognitively reframing. I did a good job. Look what I did there. I grabbed the bowl. I was able to save it. I'd be mindful not to cognitively reframe it to the negative, but try to cognitively reframe it to the positive. This is what I did right. Because neurons that wire together fire together. So the more that we're putting into what we want, not what we don't want, the more the brain is going to be able to chemically get us there quicker, if that makes sense.
Versus being like, oh my gosh, this could have happened and this could have happened. And then you go down that whole rabbit hole.
Right.
Now you want to acknowledge at least once, yes, it could have resulted
Very
in that.
good.
But that's why it's so good that you caught it and intervened and it didn't happen.
Yep, you don't want to
good?
ruminate into the negative. Very good. Because I think I teach that. Like we always go, okay, what are you feeling? We don't jump into the positive feelings. Yeah. Nicely done. We're always like, okay, what are you feeling? Well, I felt fearful. I felt, angsty. I definitely felt unsure. Okay, great. Makes sense. Let's just sit for a moment. All right, and now let's reframe into the good stuff. What did happen? And try to build the cortex and what we want, not what we don't want.
Okay, so I want to talk about this because we work through this a lot and this is something I struggle with, but also me as a mentor to my preceptee or my student, I get a hard time helping someone navigate to articulate how they're feeling, right? Oh, I was scared or I had anxiety, and I'm like, great. That could mean so many things. Yeah. So I found this super helpful, and I wish when I was teaching people I had this to be like, tell me how you're actually feeling,
right?
Because it helps with communication. I think so. Can you talk about this for a second?
Yeah. So the wheel puts you into the moment. So I ask people, how are you feeling? Well, I felt this way because yesterday my mom said, I'm like, that's not a feeling, that's a story. There's nothing wrong with stories. There's nothing wrong with that. But when you do a feeling wheel, it gives you one word and brings your body back to center, and it brings you into the moment. That's why I really love the wheel, right? How are you feeling? Give me at least 3 about how you're feeling, because usually they'll go bad.
Yeah.
And it's like, well, tell me more. Oh, they say happy. You know this. I'm like, no, give me another one. I felt powerful. Well, that's very different than happy. Right? Yes. Oh, I felt powerful, happy, and liberated. Oh, now we got a bigger word. And every time we think a thought, it makes a chemical. So we're making the chemicals to feel this feeling. That's what our brainstem is doing. So when I feel proud, my brain makes the chemical to feel proud. When I feel liberated, the brain makes the chemical to feel liberated. So we're actually flowing this into our cortex when we're doing this.
Oh, well, that makes sense, because then I put everything that I associate with bad into the bad bucket versus having different buckets for completely different experiences. But when our dialogue is limited to the one thing, then that's where the slippery slope happens, I think, of, oh, all of this has made me angry or all of this is bad, but not actually. It gave you these kind of different pathways, but you've just never tried to see it that way.
Very good, very good. We haven't exercised those pathways. The brain's habitual. So it loves whatever you've been, right? Whatever you've been feeding it. It's like if you've been feeding it angsty, insecure, and hurt, this is where it's stuck, because you've been feeding it and the chemicals have been made for it, and the next time it happens unconsciously. Yeah. So when you move into a positive way of thinking, again, we want to not jump in to positive toxicity. We want to recognize how we feel. It's important, and then reframe. But yeah, getting the one words to come into your center is really important, because it does ground you.
Yeah, and that's good, because I wish I had used that, because when you used it with me, it really made me think a little more of how I was actually feeling. And I think if I was having a conversation with someone, or we had an issue and I was trying to actually articulate how I feel, well, that hurt my feelings. Great. How? So
tell me more.
Yeah, tell me more, so that I can't know what to do or how to resolve it if I'm not actually understanding how you're feeling. And just saying it hurt you might not be enough for some people. It's not enough for me.
And we're chasing stories. Yeah. Sometimes my interns get overwhelmed. This person has all these problems. And I'm like, don't chase the balloons. Like, there's all these bubbles, in our minds. We have all these little bubbles in our little compartments. come to the core, and the core are feelings. It'll help you not to be so overwhelmed when you're coming into the feelings and not being stuck in the story.
Yeah.
Right?
Because that's like leaders will say, oh, my staff is unhappy, or they disagree with me on everything. It's like, okay, do they feel unvalued? Do they feel embarrassed?
Very good.
Are they insecure?
Very good.
And each person probably has something different. It all led to unhappiness, but they're different feelings.
Yep. And CEOs can't really look at this picture if they don't get the deeper piece, right? Because their value system, if it's a boomer and they're taken to a Gen X, or a boomer talking to millennial, I teach that in my business classes to my CEOs. It's a very different conversation. You know, as Gen X to a Z is very different than a Gen X to a boomer. The boomers are like, get up and do it, dude. Like, get it done. You know, the Gen
Get over it.
Get over it. The Gen Zs are different. Tell me a little. And there's nothing wrong. Again, there's nothing wrong with any of this. It's just know your audience.
Yeah.
Know who's in front of you so you can know how to help them.
They just process differently.
Yeah, and there's nothing wrong with it.
Listen, managers. My staff doesn't feel valued. I'm like, well, ask them individually, because what works for one person is not just going to blanket work for everybody else, especially if you have completely different generations across all of your staff.
Yeah. The love language, even though I'm not a fan of that book, but the love language, I did give it to my people because I want to know, like, do they like, hey, do they like the confirmations? Do they like money? I have another test I gave them. It's a little bit bigger. Yes, when I'm working with managers, CEOs, CFOs, it's important for them to know their audience. They need to know the generations, because they may be throwing money at a millennial, and that millennial may not look for money. They're looking for recognition. So they're actually maybe spending more time in an area they shouldn't.
Probably just getting more frustrated with you because you're not listening.
Exactly. Yeah. And you don't know what they care about. Important to know what they care about. They love family, then they want more time off. So what does that look like? If they love money, well then that's also a different conversation. Do they love training? Like as a Gen X, I thought everybody wanted to do training because that's what I did. I'd like, give me more. Z's, they were more about how do they feel? They were more, and I missed that in my first wave of hiring. I didn't really understand, but now I'm learning to go, how are you feeling about that client? What's your thoughts? Do you need to talk about it? Do you need some regulation? I don't want to go too deep because I'm not their therapist. And sometimes I'll go, hey, this really sounds like a topic for your therapist, because everybody should have a therapist. Even I have a therapist.
Educators say, and a lot of managers say, is I feel like I'm doing therapy all the time. I'm like, well, it's part of it just to get them to talk, get them to say what's bothering them. But then once you see some of the flags of this is beyond my scope, which I saw, I coach people all of the time in my
coaching's
messages.
Different. Coaching, right?
Yeah. And I'm like, this is beyond what my experience is. And even things that I personally struggle with, like I personally struggle with patient loss of life and all of that. And I'm in no place to tell somebody else how to deal with it. Just because that's how I deal with it doesn't mean it's a good way.
It's true.
It's just what I did to get through it, where I'm like, I recognize that you're struggling. Let me get an expert.
Very good. We have to know our limits. And I get people that have been coached. And I think coaches are great. I came as a life coach. That's what I used to do. But we can't be getting into inner child work. We can't be getting into systems. We shouldn't be getting into shadow work. Like, that's not for a coach. That's for a trained therapist. Yeah. Right?
To be able to take them out of it if it's too much, or know when to pull in a little bit. And
exactly.
If you don't see it all the time, then you can't really know if you're helping or hurting someone. There's a hard boundary too, because maybe that person won't go get help. Then do you ignore them? But
if I can add this too, let me add this.
Go for it.
So if I can add this for the coaches, or when you're coaching someone, make sure that you are listening. And we don't listen is good. We do this a lot. I see us both. We're like, which is confirmation, that's validation. But we want to make sure that we're like, okay, so what I'm understanding is you went into the room. Okay, just let me understand. When we do this, a mirror neuron happens in our brain. We're being seen, that we matter. The stress hormones go down, and that bonding chemical goes up. So the empathy chemical goes up. So you want to make sure that you're like, okay, so I just want to get this clear. You went in the room, you got in front of the patient, you started to sweat. Okay, that makes sense. You're going through the story again, and you'll see them leaning into you going, yeah, that's exactly what happened. And all you're doing is reiterating what you heard them say. I think sometimes my coaches or my bosses, they want to go fix it.
Yeah.
And they want to jump into coaching,
working on that.
which is normal, right? Yeah. It's normal for us to want to coach. But you may just want to take a step back and just kind of reiterate what you heard from them. And if they go, no, that's not right. Okay, well, tell me again. Because every time they tell the story, remember, it's helping that cortex calm down.
Yeah.
Because we're doing it. It's like exposure therapy to the situation.
They're reliving it almost.
Yeah. And sometimes if we're doing that with them, it almost makes them feel better from the get-go.
Yeah.
So something
it's not
to add.
so in your head, and I say use the word overwhelming. I need a wheel for the word overwhelming so I can think of more words.
Overwhelming, overfunctioning, flooded. We can say flooded.
Flooded. I like that one. And that's sometimes you work it up. They always say you do like the worst case scenarios in your head, and it's always so much worse in your head than maybe what actually happened. And that's, I mean, it's a slippery slope in the workplace, because then if I tell you this happened and I'm struggling and and we don't work through that, what you heard from me might have been way worse in your eyes. And then you go and give that feedback to my leadership, and my leadership interprets it in their own way, but that's not actually how I was feeling or why I took a pause.
It's kind of like the game of telephone.
Yeah, it's a horrible game.
Yeah.
But it's really bad in the workplace.
It's bad, right? We don't, and I see it. I'm like, I even ask, like even my therapist will be having like a check-in, and I'll go, what do you hear me saying? And they say something, and I'm like, that is not what I said. It wasn't even close. But because they're angsty, their little bubble, I call it their bubbles took it in that way. And I'm like, that is not what I said. Let me repeat it. And I repeat it, and I can see difference. So I think sometimes facilitators or coaches, oh, you got it? I got it. No. What do you hear me saying? My team
doesn't. I'm getting fired.
There you go.
That's what I hear.
Right. So what do you hear me saying? Like, make sure that they know what they hear you saying. My team does it automatically now.
Yeah.
They don't even feel offended by it. I'm like, what do you hear me saying?
Yeah.
And
I think it's a good practice, because even for a physician who kicks me off the table, could have been for patient safety, but most people are going to interpret it as they hate me. They never want to work with me again. And if you don't ask, you don't give them the chance to say why they did that, or when they did say, this is not a learning moment, this is not a teaching moment,
right?
And they make you step back. How you interpret that doesn't necessarily mean that's what they meant or what they wanted you to hear from it.
Yeah, that's true.
So I think that's a good idea. And then you just get better communication with that person from having that conversation. And if they don't initiate it, you need to initiate it.
Exactly.
This is the end of part 1, but don't worry, there will be a part 2 where we actually talk about patient loss, grief, and when to debrief with your team if you have a patient loss or complication. If you want to get in contact with Constance or have a 15-minute free consultation, you can go to her website, constantlyhealthy.com, or any of her social media channels found in the description.